In this episode, we're going to be talking about how you can go from this to this. I'm Dr. Dima Ali. I'm board certified in cosmetic laser surgery and anti-aging medicine. I also have a skincare line called Cosmetology. I absolutely love empowering people to look and feel their best. So let's get your inner glow and outer radiance to shine bright. We're going to talk about why Botox strategically injected into the penis can help with erectile dysfunction. On today's episode, we're going to be covering how Botox works, the science of an erection, what exactly is erectile dysfunction, the reasons to try Botox for erectile dysfunction, and what to expect during treatment. What does Botox do? We commonly know it as Botox Cosmetique. So for cosmetic uses, we use it for wrinkle reduction. It works by temporarily paralyzing the muscles that create wrinkles, such as lines around the forehead and the eyes and between the eyebrows. Medical uses of Botox, on the other hand, include chronic migraines, vaginismus, spasms, even excessive sweating. So how does a penis become erect? How do we go from here to here? Well, hey, are you available for a demo?
I can't come right now.
You can't come? Maybe he needs a little Protox? Let's talk a little bit about how the nervous system works. So Botox essentially works by inhibiting the sympathetic nervous system. This is commonly known as the fight or flight response. In medical school, we used to remember it with regard to the functioning of the penis by saying point and shoot. P stands for the parasympathetic nervous system. You get an erection. And the S stands for shoot, meaning the orgasm or climax or whatever Urban Dictionary slang you want to call it. Activation of the parasympathetic pathway leads to penile erection through the release of neurotransmitters. These neurotransmitters increase blood flow to the penis and relax the penile erectile tissue. On the other hand, sympathetic pathways do the exact opposite. So in a sense, the sympathetic pathways are anti-erectile. The sympathetic nervous system prevents the release of norepinephrine, also known as noradrenaline. Noradrenaline is a neurotransmitter that keeps us active and alert. So if we're inhibiting noradrenaline, it leads to the relaxation of the penile tissues. So you're thinking, wait, don't muscles need to be hard to have an erection and you're going to relax them? An erection happens when the smooth muscle of the penis actually relaxes, allowing increased blood flow to the penis. So the main muscle in the vagina is called the corpus cavernosum muscle. Sorry, did I say vagina? I meant the penis. Corpus cavernosum muscle is only in the vagina during sex. The corpus cavernosum muscle is the main muscle of the penis. When the sympathetic nervous system is maxed out, it can actually lead to vascular erectile dysfunction because blood flow to the penis is diminished. It's kind of like coronary artery disease of the penis. So what exactly is erectile dysfunction? It is the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. It starts to affect men as they age, usually between the ages of 40 and 70 years old, although it's becoming more and more prevalent in younger men due to increasingly poor diets, sedentary lifestyles, drug abuse, etc. A quarter of men with erectile dysfunction today are actually under the age of 40. What symptoms do they have? Well, you have difficulty achieving an erection, premature or delayed ejaculation. Briefly, causes of erectile dysfunction can be both physical or psychological, or a combination of both. Physical causes include cardiovascular issues, atherosclerosis, hypertension, because these obstruct blood flow to the penis. Diabetes is also a common reason that erectile dysfunction occurs. Psychological issues like stress and anxiety and depression. Depression, because you can't get it up, it's going to make you definitely not get it up. I think it's important to keep in mind that if you start to have erectile dysfunction, sort of keep that in the back of your mind as a warning sign that maybe other issues may be starting health-wise, like coronary artery disease, maybe get checked for diabetes, etc. So let's talk about reasons why someone would want Botox for erectile dysfunction. Well, you've been on the pills, you've been on Viagra, Cialis, or any of the other sildenafils, and they've become ineffective. Another scenario is you've been on the pills, but you develop some kind of cardiac condition like angina, and the doctor puts you on nitrates. If it's taken too close to the Viagra, it will likely cause symptoms such as dizziness, lightheadedness, you can faint, you can even have a heart attack. These are definite contraindications. And this brings to mind a video clip from a movie called Something's Gotta Give. There's a scene where Jack Nicholson is experiencing cardiac symptoms because he took Another reason you might be interested in Botox for ED is you've been injecting your penis with drugs, and you would prefer not to because it kind of takes the romance out of things. These are vasodilating drugs, and they're obtained by prescription. They're often referred to as trimix. Trimix contains 3 drugs: alprostadil, phentolamine, and piperavine. These work together to increase blood flow to the penis to produce an erection. Unfortunately, trimix has to be injected right before having intercourse. The effect will last you for about an hour, but it does need to be injected into the penis, like this. Yep. Oops.
It's helping prevent cock block. It's still kind of being a cock block.
Basically, very astute. Let's talk about what you expect on the day of getting treatment of Botox. You come in and we put an anesthetic on your penis, because that's the biggest question guys want to know. Will it hurt? And the answer, frankly, is it won't. We use a really strong topical anesthetic, which I have compounded. This stuff is really potent, so you won't be feeling your penis for a few hours. So try not to think about using it, because it's just not going to work. We leave that on for about 45 minutes, and the procedure itself is very quick. The biggest side effect, bruising probably, but that goes away. And I ask patients not to exercise for 24 hours. So how often does P-tox or Protox have to be repeated? Studies show that 100 units of Botox lasts up to 6 months, and the use of 150, so just 50 units more, can last up to 9 months. So obviously more cost effective to get 150 units. It can be like a once or twice a year visit, like getting your teeth cleaned or your oil changed. A little fun favor for your wifey or significant other. So I hope this episode of Sippin' and Spillin' Skinfiction was helpful. If you told me 30 years ago as a medical student that I'd be injecting neurotoxin in men's penises to help them with erectile dysfunction, I wouldn't have believed it. I probably would have said, yeah, and I'll be injecting foreskin-derived collagen in people's faces too, which is a story for another time. Please leave questions in the comments if you have any, and my Gen Z staff tells me that I have to ask you to hit the like and subscribe button so that
we get more followers.
Thanks for watching, everybody, and we'll see you next time.